Hi, I'm Julia, and welcome to Fort Healthcare's Wound and Edema Center at Johnson Creek. Persons with non-healing wounds, as well as those with occasional or persistent swelling, often find enjoying life can be a challenge, physically and emotionally. Fortunately, the Wound and Edema Center at Fort Healthcare will help you improve not only your health, but your overall outlook on life. Let's see how. Mary, what makes the Fort Healthcare Wound and Edema Center so special and unique?
One of the things that we have here is a combination. We treat not only the wounds, but we can treat the edema, and then if you need it, we have the hyperbaric chambers to give the oxygen therapy. All of the staff have specialized training, whether it's the hyperbaric tech who is certified, the physician who is a wound care specialist, the edema therapists who are LANA certified, and then the nurses who have their wound certification and WOCN. Everyone has a high level of training behind them.
Our goal is to heal wounds, not just treat them, and improve your quality of life. So we really are truly a healing center, not just a wound care center. And what I mean by healing center is working with you, the patient, so that you increase your quality of life, do more, do better while you have the wound. Plus, when you heal the wound, that you continue to stay healed, and that you have all those tools to keep you from having to come back here, because who wants to see the doctor?
Lymphedema is increased swelling in the body. It can be either in the arms, the legs, the chest, the stomach, or the face, and it can be either primary or secondary. Primary lymphedema is when you're born with it, meaning you don't have as many lymph nodes as most population, and so the fluid doesn't flow out the way it should and it gets stuck in an area. Secondary lymphedema comes from either cancers, surgery, trauma, sometimes pregnancy can cause it, and it's fluid that just kind of gets stuck in an area and doesn't seem to want to go away. And it can start at 2 weeks and people can have it for years.
I went up there and that was the best thing, the most wonderful place. Nurses were all so nice, Chris and Scott and Amy, and they doctored me up. It took me a few months, but they were changing bandages and trying different stuff on me all the time, and it finally healed up. So I was so happy, and I suggest that anybody who has a wound to go to Johnson's Creek to the Wound Center.
We actually do advanced modalities in wound healing, more than just ointments and gauze. We can do back therapy, which is negative pressure therapy. We can do bioengineered tissue to the skin. We do some for diabetic foot ulcers, special tissues that we can put on there, offloading to keep the pressure off of them, support surfaces for pressure ulcers.
Julie, what we're going to do to you today, we're going to put you in hyperbaric chambers. What it's going to do is kind of force a lot of oxygen through your body. It's going to get into your blood system. It's going to start coming out of your blood system into your plasma. What I'm going to do, I'm going to communicate with you as well too, to let you know you're at depth, start clearing your ears, not clearing your ears. When you're at depth, sit back, watch the television. If you have any favorite TV shows, you know, watch the favorite TV shows. If you want to watch a movie, feel free to bring movies in after today's treatment. This is your time. This is all about you and your treatments and making you get better.
Compassionate care, close to home care, that's your Fort Healthcare, one of the most innovative, progressive community health networks in all of Wisconsin. For more information, ask your doctor or quick click here.